On the scene by taking the COVID vaccine. Become the hero on the scene by taking the COVID vaccine. Get vaccinated as soon as you get all the facts. Don't listen to the rumors. This vaccine might just make it possible for teachers to sit face to face with schoolers. This vaccine make it safer for everybody, from the young to the young.
So we are now at the Good Samaritan Inn, which is one of our primary locations today for the first vaccines to be administered to frontline workers and vulnerable groups. So far it's been a good day. We started at 8 o'clock, it's now 10 minutes after 10, and a number of persons have gotten their vaccine, including public health nurses, President of the Nurse Association, former Prime Ministers Golding and Pattison, and many others. It has gone smoothly so far.
Get vaccinated as soon as you get all the facts. Don't listen to the rumors.
I'm encouraging all Jamaicans, healthcare workers, frontline workers, elderly, all persons with comorbidities who are going to be offered the vaccine. I know that there is apprehension out there. I know that persons are afraid. Some persons will tell you don't go. They say I'm not going to go. But I am encouraging you, not just as a healthcare worker, but as a regular Jamaican, protect yourself from COVID-19 infection.
Get vaccinated as soon as you get all the facts. Don't listen to the rumors.
As COVID-19 cases increase, persons may be required to self-isolate at home. Self-isolation means persons' movement are to be restricted to one area of the house, away from others within the household. There should be no visitors, no sharing of utensils or facilities, no washing of linen and clothes with others in the household. There should be constant cleaning of surfaces that are regularly touched with mild disinfectants or at least 70% alcohol. Self-isolation will be for persons who have mild symptoms of COVID-19 or persons who are COVID-19 positive that the health team deems suitable to isolate at home. For more information, go to jamcovid19.moh.gov.jm or call 888-1LOVE or 888-663-5683. A message from the Ministry of Health and Wellness.
Good evening, ladies and gentlemen of the press, members of the public all. Thank you for joining us for another in our series of COVID-19 conversations. We're led, as is customary this evening, by our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, who is joined by our Chief Medical Officer, Dr. Jacqueline Bissesa-McKenzie. Minister, over to you.
Thank you very much, Petrie. Good evening, ladies and gentlemen. Let me apologize. I'm tempted to say, as usual, for the late start. Not something that we should be proud about. We're going to go right into it. Thank you for joining us for COVID Conversations. We are 2, not 3 or more this evening. I'm here with my critical clinical support, the Chief Medical Officer, Dr. Bissesa-McKenzie, and the PS and the other team members are elsewhere tending to public health issues. We're going to go straight into the discussion with a brief statement from myself. First of all, to thank those who are listening online and those who had to wait for a bit, and to say that the CMO will make the presentation as usual on the numbers and comment on a few other issues. One of the issues that we will comment on is this idea of the waves that we have been through, the surges. Some refer to them as waves, but we have had 2 surges. The first one around August, September last year, and then, of course, we have had to impose additional restrictions as we have had to confront this current surge, which essentially means community transmission and therefore an expansion of the positivity cases. And what has been the lessons learned from these 2 surges? So one of the things that we have discerned, and a few things we have seen, is that there were almost 4 times as many cases in the peak week of the second surge as there was in the first. The reason is that our numbers didn't go down far enough. And so we were starting at a higher point with respect of the number of confirmed COVID-19 cases prior to how we did in the first surge. And this is important because what we saw as a consequence were higher numbers of hospitalization, higher numbers of deaths, unfortunately, and the consequences, therefore, of the surge we're currently going through has been far more severe than the first one we went through last year. And I want to just outline, and the CMO is going to be more detailed on this. In the first surge, we saw in the peak week 1,154 cases compared to the peak week of the second surge, and we're now on our way down, and we're thankful for that. But we saw 4,082 cases, so that's 1,154 versus 4,082. This translates to the death of some 31 persons in the peak week of the first surge, and we saw 59 in the peak week of the second surge. So in terms of positivity, positive cases, in terms of deaths, the second surge was more severe than the first. In the peak week of the first surge, bed occupancy for confirmed and suspected COVID-19 cases went up to 309. And in the peak week of the second surge, we saw bed occupancy more than twice that amount, 716. The other thing I want to highlight is, well, coming from this, it is quite clear that the first surge was not as severe as the second. And the second surge brought with it far more challenges. And we raise that point to say to the populace, we recognize the progress we're making as a consequence of the sacrifices that have been made from the restrictions, the better enforcement by self-enforcement as well as by the law enforcement agencies, the Jamaica Constabulary, the restrictions that have had an impact. And I want to commend both the health team, the other agencies, and the populace in respecting, for the most part, those restrictions. And we have seen the benefits of that with this week a positivity rate for the first time this year being just over 10% and an average 7-day rate of just over 15%. Remember now, we had a 40% in the peak of the second surge. But the substantive point is the second was worse for us as a people than the first. And we therefore have to be careful and not be complacent so we do not have a third wave, which would likely be worse than the second. And we came close to being overwhelmed. The hospital system, there were times when we were under severe stress. We had to make space where space was hardly available. And we would have a greater challenge if we were to see a third wave. And I want to just caution the populace to continue to recognize this as a threat, a going threat, and a need for us to be continuously vigilant until we can get the sustainable reprieve that we seek from the vaccine program and from other measures. I want to also say, before the CMO comes in, that we have gotten the results of the second batch of samples from CARFA, the Caribbean Public Health Agency. 50 samples were sent for testing to determine variant strains. And, again, the CMO will comment on why only 10 were found to be suitable for sequencing. It's not unusual, I am told. But of the 10 that were found suitable, which means that they had enough genetic material for the test to be done, 7 of the 10 were found to have the UK variant, while the other 3 had mutations that are being investigated in the US and the UK in particular, but which have not been designated to be variants of concern. Unlike the UK variant, which when it came on the scene was seen to be a faster spreading variant, the other 3 are not so considered. But the discovery of the 7 of 10 does make a point. It does say that the UK strain of COVID-19 virus is here. it is, I think, based on the discoveries, it is fairly wide scale, and it could possibly explain the rate of spread that we have experienced on the second wave or the second surge. And that is a matter that has to be recognized as we move forward. Now, you would have heard an announcement of acquiring equipment so that we can do our own testing here, because the tests have taken a while. The process does take a while, but if we had our own equipment, we could shorten that time span, and that is in motion as we speak. But the fact that we have the UK strain here would be cause for additional recognition of the measures that needs to be taken. And that's something I think the Cabinet of Jamaica will have to deliberate on in terms of how we go about doing that. You know, the CMO is going to present under some assumptions what a possible third wave could look like if we had that. And it's not an attempt to scare the population into or to panic the population. But I think the narrative must be very clear that whether it is through self-regulation or it is through policy or enforcement, the possibility, the chances of a third surge or third wave of the virus are real. They are real from experience because we see this happening in other jurisdictions. We see other jurisdictions preparing for it and predicting it. The UK, for example, has ordered booster shots in recognition of that possibility. And so we're not immune, and we can't afford to be complacent about that possibility. And I'm saying to us here today that if that were to occur, we would have significant challenges which we would prefer not to have. And so I cannot stress enough the importance of the continued vigilance around managing this virus and this pandemic, even while I recognize the contribution of all concerned to controlling and to contributing to its reduction and ultimately, over time, control and extinction. I'm going to just break here and ask the CMO now to go into her presentation. CMO.
Thank you, Minister. Good evening to everyone. I am going to just go through, first of all, some of the routine slides that you are used to, just providing you with an update, and then we're going to look at some explanation of some of the figures, and then to have a brief look at what projections could look like. So we would have seen that we would have confirmed 122 new cases yesterday. That would have been published on our website this morning. It would bring our total number of confirmed cases to 45,414 cases. We are now at 770 deaths that have arisen out of COVID, and we have a 1.7% case fatality rate. Our daily positivity rate, using yesterday's figures, is 15%. And the average of, positivity rate since the start of the pandemic until now is 16.2%. Next slide. The age groups that are affected, again, we want to highlight that the 20 to 29 age group and the 30 to 39 age group are still the age groups that we are seeing most infections in. And it's very important for us to recognize that it means that many persons within this age group are still not compliant with precautions, and they're still not using the preventative measures, the wearing of the mask, physical distancing, hand sanitizing, staying home if they're sick. So there's still a bit of moving around. They're not staying at home. We're still having quite a bit of illegal activities, such as gatherings after the curfew hours that are happening. We certainly are seeing the reports from our hospitals where we are seeing persons coming in after hours, coming from events. So we know that it is still happening, and it is within this age group that we're having this large exposure still that is putting the rest of population at risk. Next slide. However, the persons that are getting severely ill are still remaining our over 50-year-olds, in particular the over 60s, and we see that the percentage of deaths, the numbers of deaths, the percentage of deaths, the case fatality rates increases over the age of 50. So it certainly suggests that while the exposure is happening within the 20 to 39 age group, and those persons are certainly spreading to the older persons who are getting more severely ill and are also becoming fatalities. This slide looks at the risk factors and the comorbidities, and we still see that 98% of the COVID-19 related deaths had one or more comorbidity or risk factor. And we want to stress that the taking care of yourselves and the chronic illnesses that you have is very important. It's very important to get these disorders controlled, to ensure that you are taking your medications, eating healthily, exercising, stress management, because all of those things will decrease the possibility of more severe illness. If your immunity is stronger, then you will respond better, because we are seeing that 98% of the deaths had comorbidities. One of the factors, of course, is age over 60, where 73.9% of our deaths were persons over 60. But we have large numbers of persons that would have cardiovascular disease, including hypertension, diabetes, and chronic kidney disease being the most common. Next slide. When we look at our confirmed cases, this is what our epi curve looks like. And we can certainly see that there is a trending down of most of the indices that we follow. If we look at the confirmed cases in blue, we will see that the number of confirmed cases are decreasing, but this, of course, is a factor of how many persons are tested. And we will see that as well, that our admissions, which now don't have to do with how many persons are tested and probably is a better indication of what is happening in the population, we can also see that our number of admissions are decreasing. So overall, it does appear that the measures that have been put in place are having effect, and we are seeing a decrease in the number of cases and the number of admissions to hospital. In terms of our bed, and this is reflected in this slide where we look at our bed occupancy, and the bed occupancy is depicted in the blue line, and we can see that there is certainly a huge trending down in the number of beds that are occupied by COVID cases, and these are suspected and confirmed cases. We would also see that the number of our deaths are also trending down, and we can see that the positivity rate in green is also trending down. So these are all good things that are happening in terms of the illness and the impact of the disease in the country. Next slide. If we look at the admissions and the overall bed capacity, the red line shows how we have increased the bed capacity since March last year, and those are beds that are dedicated to the management of COVID cases. Most recently in April, where you have the step up, would have been the addition of the isolation beds in the field hospital at the Spanish Town Hospital, and that would have increased our number of beds to over 600 beds. We would see, though, that the occupancy of those beds have been decreasing consistently since the beginning of April. However, all of these decreases are not reasons to relax. Let us look further. Next slide. Let us look at the health system pressure levels using bed occupancy. We have to recognize that the total number of beds that are being used for COVID, not many of those beds are new beds. Quite a number of those beds are beds that we would have taken out of general occupancy. So beds that would have normally been for surgical patients, for patients of internal medicine, many of those beds would have had to be converted to COVID beds. So while we would have put in some new beds, many of the beds would have been beds that were there before that are now being purposed for COVID management. It means that there is still a bit of pressure on the bed occupancy in the hospitals. And it is going to take, we will have to decrease the number of beds occupied by COVID patients considerably to decrease the disruption, to minimize the disruption to the other services. So we look at the numbers of beds in terms of the pressure that is on the health system in terms of this color code, where you see that with the green code is where there will be minimal disruption to other services. And now we will look at that in relation to the graph of bed occupancy. Next slide. So here you see that when we went up to our highest number of beds being occupied in March, if you follow the white line and you see that it's at its highest peak in March, and we would have been over the beds that were designated for COVID. In terms of our coding, we would have had very high level of pressure on the health system, a very high level of pressure on our hospitals, because not only would we have been utilizing beds for COVID, we would now have been utilizing beds that were for the other services. Not only would we have been using staff that some of them newly hired to manage COVID, but we would have been utilizing staff from other areas, and we would have had the staff under considerable pressure. Also, in terms of supplies to the hospitals, those would have been at a very high usage rate, and so we would have been under a very high level of pressure to the health system when our numbers were in that very maroon red, above 600 beds being occupied. But if we went down to between 400 to 600, we are still in the red level, because we still would have had considerable pressure on those same services in terms of other beds, in terms of the staff, and in terms of supplies that were needed. So even though we see that our numbers have come down and we've fallen from 600, 700 down to a little bit less than 400, we are only just now a little bit out of that red zone where we would have had high pressure on the health system. And it is not until we reach down to a level of about 150 will we be in the green zone, where there is minimal disruption of health services. So we still have a considerable way to go in terms of moving from just under 400 beds occupied to 150 beds occupied for COVID. So there's still a lot of pressure there. It is, while we are trending down, there is still a lot of work to do to get our numbers down to where we can safely manage within our health system. To look at the positivity rate as well in terms of that same degree of pressure, because we now see that our positivity rate is trending down, and many persons would have seen us gone from in the 30s, near 40%, down to now in the teens. But where do we want to be? Remember that very early in the pandemic, 5% was what was looked at the level that we want to be at, and countries were required to be below 5% consistently for a while before they could relieve any kind of restrictions. So the positivity rate is the number of COVID-19 positive tests over the number of COVID-19 tests done. Next slide. And here we would see that greater than 10% is very high transmission. We had gone up to 38.9%. So we were way above the very high transmission. High transmission is 8 to 10%. Right now, we have not reached down to 10%. So we are still in the very, very high transmission. We need to get down below 5% to get into the green, where we can feel comfortable to relieve restrictions. Next slide. And this is what it looks like when we look at the graph in terms of the number of cases. And here we see the last time that we were in that green zone was before the first wave, which was in August, July, and the beginning of August, when our positivity rate would have gone down to as low as 2 or 3%. That is where we need to get back to. And just to look at this slide, you can just imagine that if we were at a 2 to 3% positivity rate at the start of the first wave, and we went up as high as 25% in the peak of that wave. For the second wave, we started, look where we started. We started at 10% on average positivity rate, and we ended up at 38.9%. Now, can you imagine if we were to go into a third wave, starting at a 15% positivity rate? It means that our number of cases would be far more than what we would have peaked at before. Next slide. Next slide. So to look at the reproductive number. Now, the reproductive number represents the average number of infection that an individual transmits. So one person with very strong, without any public health measures, the reproductive rate for COVID was about 2 to 3. And so we were expecting that one person would transmit to between 2 and 3 persons. So that's without any public health measures, and you would expect that there would be rapid spread in the population because so many persons were being infected. Now, with strong public health measures, we would have come down to below 2, and we would have seen that our reproductive rate would have gone down at times to 1.4, 1.5 when we had some strong public health measures. But we needed more than that, because we needed to decrease our reproductive rate to below 1 so that we were not transmitting. It means that one person would not be transmitting the infection to anyone. That means that that person that is infected is staying at home, they're not exposing others, and therefore the infection will die out. That is what we want. No transmission, a reproductive rate that is tending towards 0. And that is why we had to have stronger measures put in place to bring down the numbers quickly, because we were surpassing what our health system could manage. Next slide. Next slide. So this graph is a little bit fussy, but what it shows is that the effect of the measures that we had put in place, and how it is that after we had imposed restrictions on public gatherings in terms of the use of places of amusements, when the reproductive number was high, close to 1 to 2, we would have introduced those measures, and you would see the blue line would have dropped down below 1. When we would have increased our curfew hours, then you would have also, the curfew hours are in the orange, and you would see that when we increase the curfew hours as well, the blue line is down. However, when the curfew hours are decreased, when the measures, and usually what happens is that we see that our whatever we're doing is working, the restrictions are working, the numbers start trending down, and then we start to feel that we need to open up and we need to allow more movement. And as soon as we do that, we see the reproductive rate going up, and then shortly after the reproductive rates start going up, then our numbers start to go up again. So it is very important that we recognize that the use of restrictions, the use of curfew, has positively impacted the decrease in the number of cases and to get the epidemic under control. Next slide. Next slide. And what will happen if we do not maintain our restrictions? There is the possibility of a third wave. We see that several countries have gone into a third wave. I mean, countries like Italy, Germany, Hungary, France, Poland, Spain, India, Pakistan, Bangladesh, Indonesia, Philippines, Brazil, Peru, Iran, they have all gone into third phases. And why has that happened? Because as soon as there was a decrease in the number of cases, persons started to become complacent. And we started to lift restrictions, more movements. Persons started to feel that they had to have the freedom to have gatherings, and there were mass gatherings in many of these countries. We can see very, very clearly, what has happened in countries like India, where with the release of restrictions in February, they have now gone into a third wave. It can happen to us. It can happen to us because, as the Minister has said, the test results have come back. It does indicate that we have quite a bit of the UK strain in country, which means that there is a high level of transmission coming out of that strain. We have seen that the exposure in the 20 to 29 and the 30 to 39 age group is pretty high with a large number of infections. So if it is that we are not careful and do not continue to have measures that decrease exposure, then we can go into a third wave. And what will a third wave look like? Our starting point is not going to be as low as it was in August last year or even in December of last year. We're going to have higher starting points that are going to result in possibly very, very high rates. Let's look at this next slide. Where we could have the possibility of as much as 10,700 cases in the peak week compared to 4,000 cases in the peak week of the second wave and just over 1,000 cases in the peak week of the first wave. Now, it means also that as the number of cases go up, then we could have deaths going as much as 180 deaths that could occur in a week, in a peak week, where we had 59 in week 11, which was a peak week of the second wave, and 31 in week 41 of 2020, which was the peak week of the first wave. Now, 180 deaths in 1 week is something that we would not want to see. It means also that there's going to be a severe stress on our beds. And where we went up to 716 beds at peak, we could be going up to needing as much as 1,900 beds. Do we have 1,900 beds? We do not. We do not. And we see what is happening in other countries. Hospitals are closing their gates because they do not have oxygen. They do not have beds. It can happen to us. And now is the time that we have to ensure that we take the precautions, that we continue to maintain our restrictions, we decrease exposure, we wear our mask, we keep physical distancing, we stay at home, avoid gatherings, social gatherings, business gatherings, any type of gatherings. We avoid those gatherings to decrease exposure so that we can keep our reproductive rate down, keep our positivity rate down, keep our hospitalizations down. Thank you, Minister.
Thank you very much, CMO. Now, the intention of this press brief is certainly, as I said, not to cause persons to panic, but it's important that as we go along, we learn the lessons of this pandemic. There's no playbook. There's no sort of practical experience except possibly 100 years ago. And so we have to survey the landscape, look at what is happening in other countries, look at our own experiences, do our modeling, and look at our resources, and of course make some projections as we advise the public. We have always felt that communication is going to be very important so persons understand, and that personal responsibility becomes absolutely critical so we know exactly what our role is. And so it is a moment to pause and reflect, to celebrate the achievements that we have made to date, and certainly as it relates to this second wave or surge. But we're saying what is happening elsewhere in the world suggests that the third wave is very likely, and that's something that we'd prefer not to deal with, which is why we have to manage. Now, I want to just turn quickly to next week. We will begin to administer the second dose of the COVID-19 vaccine for persons who have already received their first dose. And that's starting, I think, around the 5th or 6th. Some 39,000, well, it's a little more than 39,000 persons will become eligible for the second dose of the vaccine during the month of May. 40,000 doses of the 55,200 that arrived in the island earlier this week are reserved for these persons. The remaining 15,200 will be pooled with the 11,800 that we previously had in stock, offered to current priority groups. In fact, we've started that process already. Getting this second dose, ladies and gentlemen, is very important. It's critical as we seek to get the maximum protection from the vaccines. And we're putting the necessary arrangements in place to make contact, for you to make your appointments. You have a card, those who have received a first dose during the month of March. You can revisit that card to remind yourself as to where you were, where you went, and what needs to happen to take the second dose. It's so important that we do not get complacent thinking that a first dose is enough. It will give you some protection. That protection diminishes over time, and the second dose is what you need to give you the optimal level of protection. And in an environment where we anticipate the threat being still real and potentially still very dangerous, it is so critical that we make the effort to take that second dose. So we are taking necessary actions to create the enabling environment for persons to get their second dose, even as we continue to vaccinate new persons. And we have been having discussions, having meetings, looking at the locations, improving where we need to improve to ensure that it's a smooth process, and essentially preparing the team to respond to the obligation that they have. Last year, we were not without challenges, of course, with the community transmission, as explained by the CMO, and we really want to avoid a return to that scenario. And so it is so important that that second dose becomes a critical part of our narrative as we seek to bolster our resistance to the virus. So that 39,000 plus Jamaicans, I want to say to you, as I've said before, we have a dose for you in reserve. That dose is going to be made available starting next week. Make it your duty in your own self-protection to take your second dosage as we continue to ensure that we inoculate as many persons as possible. And I'm going to stop here due to the late start, and then hand over now to Petre to have any questions that may be out there that we need to respond to. Petre?
At this stage, we open the floor for members of the media to present their questions, and invite you to use the raised hand feature to do the same. I'm not seeing any hands, Minister, but there was a question from Debian Pinacarvi that says, why are we allowing the UK to enter come May 1? Based on the situation with the variants.
Okay, so there has been an ongoing assessment around the management of the pandemic while trying to balance the need for economic activity, balancing lives with livelihood, as we have said. It's a fluid situation. The Prime Minister is on record of saying that while that is an imperative, we take action and make policy decisions based on situational circumstances, situational specific circumstances. And the expectation is that the management of the process leading up to that point would allow for that decision to be made, because we look not just at the historical, we look forward and we plan based on the data. Having said that, Cabinet meets weekly and sometimes multiple times each week. There is a meeting scheduled for this weekend of the subcommittee. The Honourable Prime Minister chairs that meeting and has provided good leadership and wisdom on these matters, supported, of course, by his team. and I anticipate long deliberations on the weekend around all that have been said, looking at where we are, looking at where we need to go, and decisions taken. That becomes no recommendation to Cabinet on Monday. And at that point, of course, the public is so advised. I think in the wisdom of the executive arm of government, we have operated in that way and with that openness and have guided the process to date. So I ask for continued patience and confidence in that process. And if decisions are made or adjusted, as the case may be, it will be a function of those discussions. So I know this is a roundabout response. The long and short of it is that we take decisions, we review decisions, and the ultimate decision maker starts with the Cabinet and its deliberations.
Thank you, Minister. Debbie Ann Wright, the next question is yours.
Okay, good evening. In light of the possibility of a third wave, what's the health ministry doing to prepare in terms of preparing health systems, looking at our oxygen supplies, etc.? And I also know that the health minister said that the cabinet would determine next steps, especially as it relates to the results of the variant testing. But I just wanted to know, what are the recommendations coming from the health ministry?
So this is how it works. We rely on the technical team, the clinical team led by the chief medical officer beside me here, but supported by a number of other units and individuals, the epidemiology unit, Dr. Webster Carr and others, to assess, and it's a daily assessment, literally multiple times a day. I mean, I have to say significant recognition and commendation to the team, because we have been at this for 13 plus months. Actually before, because we started prior to the first case arriving on March 10th. It is based on those assessments that recommendations are generated. And based on those recommendations, very considered recommendations, that a conversation, discussion, and ultimate decisions are taken at the level of cabinet. And that has wide-scale implications. It's not just around restrictions. It's around using creative ways to balance lives and livelihood. It's around budgets and allocation of protective gear, because we anticipate what is needed in the month or months to come. It's around converting hospitals to new spaces for beds, adding field hospitals as the case may be, as we have been doing. And I could go on and on. The decisions are quite complicated because it involves so many different processes and individuals and functions. And so what I'm saying to you is that this will continue to guide the process, and those deliberations will continue into the weekend and from there into the next week. And if there are needs that are going to be there for expansion or further expansion, because we continue to expand as we go along. We haven't stopped. Decisions around oxygen, what do we do? How do we support expansion so we don't run into shortages? I think that's a big issue, and I think we're going to have to take some decisions on that. Decisions around possible additional beds, given that we're suggesting a third wave may lead to greater demand. Decisions around how we treat with elective surgeries versus dealing with emergencies. Those are things that are going to be important, and I don't know if the CMO wants to comment further on that.
Right. So I think right now the emphasis, while it is that we try to prepare, the emphasis really is on prevention. We have seen larger health systems than ours collapse because of COVID. the fact is that if our projection is that we're going to need 1,900 beds, we really do not have that capacity. And the possibility of us putting that in place we have put in so much capacity over the last year for us to have almost 700 beds dedicated to COVID. We have to recognize that it's not COVID that we are going to be dealing with as the middle of the year and the end of the year approaches, because traditionally this is a time that we have an increase in hospital visits, because we have a rise in other transmissible diseases such as gastroenteritis, leptospirosis. We have the vector-borne diseases that also increase at this time, and we know that that starts to go up in July and tends to peak at about November. So we are at risk of other illnesses that need the hospital services. And we have to really concentrate on prevention. It must mean that everybody has to make it their responsibility to ensure that we do not go into a third wave. And so the restrictions that are put in place need to be maintained because we need to decrease exposure. And I mean, I don't think I can emphasize it more. The health system is under extreme pressure at this time. Our healthcare workers are overwhelmed. We have seen our numbers going down, and everyone is so grateful to see the numbers going down and to have a little ease of the pressure right now. And it is very, very difficult if we anticipate that if it is that persons are irresponsible and we go into a third wave and we have the potential of this kind of impact that I have laid out for you happening, then we run the risk that where larger health systems have succumbed, that there is a real possibility that we could. So I think prevention is what is important at this time, and persons need to concentrate on that.
Thank you, Minister. Thank you, CMO. Before I invite the next question, I'd like to pause just to acknowledge and welcome Dr. Melody Ennis, our head of Family Health Services, who has joined us online. Thank you for joining us, Dr. Ennis. Stevie-Ann Simmons, NNN, you have the next question.
Hi, good afternoon. Can you guys hear me?
We can. Please
Hello,
go ahead. Yes, we're hearing.
Yes, good evening. My question is to Minister Tufton or the CMO, anybody who was willing to answer. How would you react to concerns from people who are concerned about the government lifting and not planning to extend the UK travel ban on May 1?
I think I attempted to answer that question earlier, and that is that the decisions around restrictions are taken based on considerations around the assessment at a point in time, as well as projections going forward, with the ultimate aim being to provide the optimal protection to the population while also ensuring that we have economic activity continuing. And it is on that basis that those conversations have taken place and decisions made. I also indicated that the Cabinet meets regularly, and the COVID subcommittee similarly so. There's another one planned for this weekend, the subcommittee of Cabinet. And so the environment is quite fluid. Those decisions are taken based on considerations by the technical team and the assessment that they provide. So I'm saying to you that decisions are not just taken, they're taken with all the considerations, and those considerations sometimes vary with very short life cycles. So let us see what happens. But the decision had been taken based on an assessment of where we're headed, the management of the process, and the need, of course, to balance the lives with livelihood.
Thank you, Minister. Our next question goes to Emma Lewis. Emma?
Sure. Hi, good evening, everyone. I know this is a very complicated topic, but in terms of the vaccines, I'm not getting a sense of what impact the level of vaccination would have, say by the end of the year, on our numbers. I mean, I'm not sure if it is, perhaps Dr. Ennis can help with this, but at this point, are the vaccines basically making a difference or going to make a difference? If that makes sense.
Good evening, everyone, and thank you so much for that question. The vaccines will make a difference over time, but we've got to be patient. Now, we have started to vaccinate the most vulnerable group, and that would be our elderly persons. And we know that once they are fully vaccinated, we will expect to see a decline in hospitalization and certainly deaths. But we have just vaccinated some 50,000 in that group, and we have about 250,000 persons in that grouping. Therefore, we are way away from the target at this time, and being mindful that these persons would have only received their first dose to date. Now, after you get the first dose, some about 28 or so days after that, you are protected at about 70%. But as time goes on, by the time you get to about 3 or 4 months, you're down to about 30%. So we do need the second dose to boost. And as we continue to vaccinate more of those vulnerable persons, I'm sure over time we will see a difference in severe illness, hospitalization, and or deaths.
Thank you, Dr. Ennis. The next question goes to Jamaica Social.
Hi, good evening, guys. 3 questions. The first is testing kits. The US is now literally pushing everyone, a lot of persons, to test kits, which they can acquire at pharmacies and other such. And people can do the COVID-19 tests at home. A number of people have been asking us if Jamaica will be acknowledging those type of tests, or are you still strictly sticking to tests that are done in a more formal situation? That's one question. The second question is a lot of talk about England and the UK strain, and we've heard, we found, a decision was made late last year to ban England, but I've not heard any official word, or maybe there were, but I haven't heard any official word regarding India and Brazil. What is there an official restriction against those, or is there any plan to restrict them, seeing that they're really struggling with coronavirus right now? And the third question is to the CMO regarding recovery. Seeing that now, when we last asked you this question about a month and a half ago, you said that recoveries were lagging behind, or the energies to get recoveries processed were lagging behind, because you were focusing so much on dealing with new cases. Seeing that you're getting somewhat of a reprieve, should we now expect recoveries to be at where they were, say, in December, heading to 200 and more? That's it.
I think I'll take the first question, the last question first. Certainly we are working to bring down the numbers of cases that we have for release from isolation or quarantine. But I just want to remind persons that despite the fact that the numbers do say that we have those as active cases, we also do publish the number of cases, certainly in our press conferences. I didn't do it today, perhaps I should, but we normally do say how many cases have been confirmed positive over the last 2 weeks. And that really is what gives you the true picture of or truer picture of the number of active cases. Truer because, I don't know if truer is a word, But if it's a trend, because there are some persons who may be ill and for more than 14 days, and so that would add onto the number of persons confirmed over the last 14 days as being active cases. Also to remind you that when persons are in fact given their positive result, they are informed that after 14 days that they would be released from isolation, and then they can contact the health department if they need a certification to get back to work. Now, it is our intent, of course, to contact everybody, and some parishes are better at this because of the number of cases in each parish. Because the process of release is that we normally contact you, find out if you're having any symptoms, if you're well, and then if everything is fine, then we arrange for your discharge from the system. So it is a formality, essentially. It is not that we actually have 20,000 or so active cases. It would help if we would look at the number of cases that are confirmed. But I do know that it really does create a problem when you look at the numbers, because we are looking at what is written in the system. I remember the other question.
Thank you, CMO. We have a question here from Garfield Angus of the Jamaica Information Service. And Garfield is asking for a confirmation of the date for the next round of vaccination, and further whether that same date will apply for persons who are to receive their second dose. So what is the confirmed date for the next round of vaccinations, and persons who are to receive their second dose, will that date also apply?
So we would have put out sometime last week that we would have restarted vaccinations on the 26th of April. So this has been widely publicized. There has been a full-page ad in the newspaper, and we would have had it on our website, Petre? Yes, and we would have been announcing it, that the appointment system is open for persons who are over 60 and in the priority groups to be vaccinated. So we do have approximately about 20,000 doses that are not going to be for second doses, that we need to get those persons vaccinated. And I must say that starting on the 26th of April up until now, we've had a very low turnout for these vaccines. We think that some persons may be believing that the vaccines are reserved for second doses, and are not quite sure. But I just want to announce it again, that the appointment system is open. Persons can call the hotline to make an appointment, or they can go on the website to book an appointment, or they can call the health department. Or if you are over 60 and it is that you are having difficulty, then if you show up at the vaccination site, then we will register you at that time. But we have been having poor outturn for the vaccine now in this period, and we would want that to be increased. And this is happening in all parishes. So call your health department if you are not clear what are the sites. If you go on the website, when you go on, the sites that are available to you will be there, and you can book your appointment. We encourage everyone over 60 and in the priority groups, take advantage of this now.
Thank you, CMO. I see no more raised hands, and so at this stage I hand over to our Minister.
Okay, thank you very much, Petre, and thank you, CMO, for your contribution this evening, and to the rest of the team, Dr. Ennis online. Ladies and gentlemen, you have heard from the numbers presented for COVID-19, and the cases are definitely trending down. This is very positive, very, very positive. It says that we are working as a team, not just public health, all the other agencies, and indeed the Jamaican people. And, you know, we need to view this as a very collective effort. Despite cases of deviant behavior, for the most part, I think all of us must share in the in the recognition of our contribution to this cause. In the last day, Jamaica recorded 122 new cases, 0 deaths, and 103 more recoveries, with a positivity rate of 15%. The day before that, the island recorded 80 new cases, 3 deaths, and 113 more recoveries. And the daily positivity rate was 10.8%, which was the lowest since the start of the year. And again, that would have been an achievement, a positive achievement. The 7-day moving average, April 22nd to 28th, for the positivity rate, which is a trend which tends to give a better picture than a snapshot of a day, is 16.2%. And this, of course, is a good indicator of the response of the gains from our COVID-19 efforts, the gains from the efforts. Integral to those efforts is our promotion of adherence to infection prevention and control measures, the usual that you know that we repeat every day: the physical distancing, the wearing of the mask, the frequent hand washing and hand sanitizing. And so it's important that infection and prevention and control measures be maintained. Those measures including, among other things, the interventions over time within communities, quarantining where necessary. These cannot be overemphasized. It is a very important preventative measure. And as the CMO said earlier, there's no substitute for the prevention measures. We have to adhere to those and continue to do so in the foreseeable future. So far, more than 140,000 persons have been given the first dose of the vaccine, and we will continue to grow those numbers towards achieving greater coverage and protection for the COVID-19, against COVID-19 for the population. And again, I say, it really requires all of government approach. The numbers are encouraging. The forecast today may be somewhat alarming if we were to have a second surge. And as I said, it's not an attempt, a third surge. It's not an attempt to scare you, but it's a reality that we see happening elsewhere in the world. And I think we have to be very careful to manage that process. And so I leave you this evening by saying, let us recognize the achievements to date, but let us also be sensitive to the commitment to the future and our collective responsibilities to ensure that we maintain our posture of being cautious. And for those who are about to get their second dose, it is available for the month of May, for those who received in March. Just follow up, do the inquiries, we will make contact. If we don't, you follow up, and we will ensure that you get your second dose. Please follow up to get it, it's important, while we continue to provide a dose for another 28,000 persons, starting with the vulnerable groups. After this discussion, today is a double whammy, and for those who may be interested, I'm going to be having a COVID chat at 8 p.m. with Ramesh Entertainment. That's the CEO and the founder. And this discussion is going to be a discussion around COVID and vaccines. And this has been promoted. He's fielding questions that I'm sure he will have personally, but others would have submitted questions. We're going to have a little down-to-earth talk. And so I'm going to move into another gear. So those who want to join us, you can join on the Instagram live page at Ramesh Entertainment or at Chris Tufton. And let's talk about vaccines and COVID. And I'm prepared to answer whatever questions I can. What I can't, I'll record it and we will provide the information later on. So tune in at 8 if you want a further conversation. I know there are a lot out there. There's a lot to consume, but I think it's important to be available and accessible. And Ramesh has done a lot, actually, offered a lot of support to the COVID response. And I know he will break things down in his own way to reach those who follow him and support him and his efforts. And I look forward to that. So thanks again. And for those who are interested, I'll see you at 8. Thank you.
If you are 60 or older like me and have underlying health conditions such as high blood pressure and diabetes, you are at a greater risk for severe illness or death from COVID-19.
After more than a year of being under COVID restrictions, it is also time to do what is necessary to get back to life. That's why senior citizens have been prioritized for vaccination.
The vaccine is safe and effective. I have taken it and I'm feeling just fine.
I've also taken the vaccine and I feel so much more at ease.
Get vaccinated and get back to life.
This is an important message.
We're here at the Norman Manley International Airport collecting another shipment of COVID-19 vaccine, AstraZeneca. Those persons who got their vaccine in March, guess what? Your second dose is here. We have one for you in the month of May. So look out and please go get your second dose.